Done.
Lagos. It is that time where we get to talk about our health here on Smooth Health. My name is Joy Ureye, and I'm joined, well, today on Smooth Health, we'll be talking about superpowers of breast milk for newborn and premies. When I say premies, I am talking about premature babies. In case you don't understand what that term is, well, now you get the essence of it. And joining me to have that conversation this evening, I have two doctors. See, when you're blessed, you're just blessed. I don't have one. I have two doctors who will be joining me to have this conversation. I have in the studio with me Dr. Lope Adejuyigbe. Adejuyigbe.
Yes.
Okay, now I have to no, yeah, it was a mouthful, but now I get it. Apologies. And then joining me virtually because this see one doctors are always busy, but once you have them, it's a blessing. I have Dr. John Ameh. Good evening, Dr. John. You're muted. You're muted.
Yes, hi, good evening, everybody. How are you?
Hi. Well, very well, thank you. I can see you in your scrubs. I already know that work is happening somewhere in the background, but it's a pleasure to have you here with us all
I'm
the
happy to
same.
be here with you as well.
Ah, the pleasure's ours as well. All right. So to well, Lagos, this evening we'll be talking about breastfeeding, how it is a superpower, and why it is of utmost importance. But you know what? I think I'm just going to start with Dr. Mokwe, and I'd like her to explain to us why breastfeeding is even why it's even considered a superpower in the first place. I know, yes, they say it's the first milk or it's the first food a baby's supposed to get them going. I know water. Oh my days, it's not water. So yeah, I'm not wondering. Okay, help us understand why it is a superpower.
Okay, thank you so much for the question, Joy. I think it's even important because breastfeeding is dynamic. That's the very first thing. There's no other food on earth that is dynamic, that literally changes minute by minute. So all of us, all women of reproductive age, have something called a storage capacity
Okay.
regarding like breast milk supply. Once you are pregnant, so your breast fully mature,
Okay.
and then you develop something called a storage capacity, meaning the amount of milk that you can hold at any time in your breast if you are breastfeeding, if you are lactating, just like the baby. But the interesting thing about that is as your baby comes to breast, it changes per time. Yes, it actually changes per feed. Like as your baby is sucking during their feed, the composition of the milk adapts to what your baby needs. During the course of the day, the composition adapts to the time of the day. For example, during the day, there's more cortisol in breast milk, keeping us alert. And during the night, there's more melatonin helping us sleep. So yeah. So and even over the course of the entire lactation journey. So for example, the baby is born, we have the first milk colostrum that's very yellow, sticky, small.
I saw that the first time. Babies understand what is going on.
But colostrum is like the most important vaccine. First of all, it is a vaccine, then it is a laxative. Because in the early days, we want baby to poo a lot to prevent something called jaundice or to help treat jaundice. And then it is nutritive. Also, it helps our gut health. It acts as a prebiotic, feeding the bacteria in the stomach. So this prevents issues like IBS, inflammatory bowel disease, things like asthma, just atopies and allergies, all these things. It goes a long way. And that's just the tip of the iceberg because that's just nutritionally. But breastfeeding, like I say, like it's nutritional, but it's also good for mommy and it's good for the planet. It's even good for us in terms of economics. It is because breastfeeding has no waste. There's no waste product of breast. So there's nothing to throw away, there's nothing to burn up, there's no, carbon being released, unlike, when you have teens, exactly.
Which we shall also touch on in a bit. Because if you just tuned in, this is Smooth Health on Smooth 98.1. My name is Joy Ore, and today we're talking about the superpowers that are embedded in breast milk. And well, we're focusing on newborns and preterm or premature babies. You have questions, you have contributions, you can be a part of the conversation this evening. I've got two doctors with me. Yes, two doctors, not one, not two. I've got Dr. John Ameh and Dr. Lope Adejuyigbe. You want to share your thoughts this evening? That is very welcome. WhatsApp is the platform to do that. 0911 999 We're going to take a very quick breather under a second. Oh, no, that's me preempted. But after that quick breather, we'll come back to understand why some certain people or why some mothers are not able to lactate and have breast milk, and why sometimes they have to go on formula. You see this formula thing? Some people even confuse it for water, but I'm going to touch on that instead of quick breather. Don't move on myself. It seems one Friday. What's your so good. A certain person says to say hello to you on the other side. You're muted, by the way. Televisions, air conditioners. You're still muted. Washing machines, and lots more. Visit any single. Can you unmute? Kathy Street, Alasa, Allen,
I don't think you can hear.
City Mall. Can you unmute?
Okay, I've got my hands full, so that's why I was unable to come.
No, we understand. We
So
understand.
Lope has a lot of work to do. But where I was gonna come in was on the part of at Reddington we are fully breast milk compliant. We are fully breast milk compliant. We don't do formula feeds except if we absolutely have to. So we are open to having Premies come to our facility. We are very equipped and we have what it takes to manage Premies. So basically, that's where I was going to come in from.
So hold that thought. You possibly will be the one who's going to share all that information as we get back in. Just hold that thought. All right, Lagos. Yes, we're talking about the superpowers of breast milk for newborns and preemies on Smooth Health today. If you just joined in, you haven't missed so much. Yes, we've talked on breast milk, what it is, what's important. And like I say, I have two doctors with me talking about it, explaining inletly why breast milk is a superpower and why it is important over what most people will want to have as formula. No. And talking about why it is important, thankfully, I have Dr. John, who is also, well, he's not physically in the studio, but I have him virtually with me. So, yes, let's get back to the conversation of breast milk. And we were talking, I was asking Dr. Lope earlier on as to why it is certain mothers can lactate, so they also have to get, formula for their babies. Walk us through as to when it is important or why a mother will skip having to breastfeed and then use formula. Did you catch that?
Okay, I didn't get that. Maybe say it again.
So, walk us through at what point a mother would have to give a baby formula. When does that even become a thing?
Oh, okay. Thank you very much. Again, I say I'm quite excited to be joining on Smooth 98.1 FM today. Something I've been looking forward to. I'm also very glad to be joining with Lope. Lope, hi. So, talking about importance of breast milk, it can never be overemphasized.
Right.
Many times we wish that mothers can, start lactating as soon as possible. In fact, some schools have it that within the first 30 minutes, if a mother delivers normally, you should be able to put the baby to breast. If the mother delivers via cesarean section, 1 hour to 2 hours, you should be able to put the baby to breast. The reason for this is, as much as possible, breast milk has a lot of importance. In fact, one of the most important, especially for preemies, is protection against certain serious complications, like what we call necrotizing enterocolitis. Necrotizing enterocolitis, I know it's very wordy. It's an intestinal infection. that happens especially when a baby is born premature. A baby starts formula feeds, and the baby has another infection around the tummy. So breast milk, it's God's given gift to these babies. So it's like gold. And the challenge we have with this is that mommies that deliver prematurely are unable to provide or produce or even lactate, if you like. Hence, where do we get breast milk from? That is where Lope comes in. You see? Now, the second thing is it also prevents issues with the eyes. If you remember this musician, what's his name? Very popular American musician. We are the world, we are the children.
That's Michael Jackson.
Stephen Wonder.
Oh, okay.
No, Stephen Wonder was born.
Okay.
Yeah, he was born premature, and then they had to give him oxygen for a long time, and now had what we call retinopathy of prematurity. Whether he took formula feeds or breast milk, we don't know. But in breast milk has been shown to prevent against retinopathy of prematurity, as it can reduce a lot of lung issues. So it's a fantastic solution to a lot of problems. It helps with immune support, it helps with better digestion, it helps with gut health. So Lope has a lot of work to do in Nigeria, pushing for breast milk for Premies, and I wish her all the best in her journey. But at Reddington Hospital, we are fully committed to breastfeeding, even at these very premise stages and premature stages. And we found over time that we hardly have these issues, these necrotizing enterocolitis, retinopathy of prematurity, immunity problems, infections, and our babies do well neurodevelopmentally after a long period of time. So we are open. We take premature babies. We are quite committed. We have our equipment. We are heavy on mechanical ventilators, incubators. We even have we're quite sophisticated weaponry for newborn care.
I like the word weaponry.
So we're very happy to have people, and I'm also very excited to say that Lope has been joining us. So we're very happy.
You have a capable team, more or less.
Yes.
Awesome stuff.
Comfortably, I can say that we have a neonatologist, of course, my humble self. We have a very packed team of very trained neonatal nurses, pediatric nurses, and also we have pediatricians that are able to work around this equipment. But since the topic here is breast milk,
we should switch gears and go back to Dr. Lope.
Know that we are very committed to breast milk, and the importance of breast milk and breastfeeding can never be overemphasized, especially amongst premies. Yeah.
Thank you for sharing your thoughts on that, and pleasure having you and you helping us understand how it all works. Now, let's switch gears. We'll leave you to go back to what it is you were doing, because I can see you in your scrubs and all. So we'll catch up with you sometime in the future.
Thank you very much. It's been a total pleasure to be with you. I hope that we make this happen again very soon.
Most definitely, we'll do that. All right. Now let's switch gears and get back to you, Dr. Lope. And now there's a lot to put on your table.
Yes, everything gets rotting.
Oh my days. So let's talk about mothers who can't lactate. There's been the notion that there are certain things they have to eat, they have to drink. I don't even want to put anything. I don't want words in your mouth. But say, for instance, they can't breastfeed within the first hour, 2 hours, 3 hours, and the baby's crying, needs food, needs something to keep it going. What happens? How do you help the mother?
Okay.
And how do you help the baby?
Okay, just to set the stage, I've been doing this for a while now, and I would say, like, even in just the last year, I've been doing this longer than a year, but just last year alone, I have not met any mother who has come to me saying, "Oh, I have hypolactation or hypogalactia," which is what we call it, meaning low breast milk supply.
Okay.
And it was a true low breast milk supply in that, oh, there's something anatomically happening that makes her unable. The first problem, and I'm a doctor, so obviously I'm not attacking the system, is that we just are not trained enough. Yes.
Right.
So the first thing is you meet a mom and she says, "So my baby's a month old and like I can't make enough and I'm combo feeding." And for a lot of mothers, we must remember that breast milk has all these benefits and breastfeeding has all these benefits. But most mothers want to breastfeed you because they've attached a sense of self-worth to it. So for them, it's even more than, oh, what am I giving my child? Is I should be able to breastfeed. You know, it's very exactly, it's like a scorecard for them. So they want to, there's that invisible thing, like, why can't I? Why can't I? And then you ask, okay, so what happened? Because the first hour is important, the first 2 weeks are very important. And they say, well, I started breastfeeding on day 3 or 4 because my milk just came in then. Or at the hospital, I was told that I didn't have enough milk, my baby would be hungry. So my baby was placed on a bottle of formula, things like that.
Right.
So
which I have heard, by the way.
Yeah, but that's fallacy. That's completely wrong. Your body starts making breast milk from when you are 14 to 16 weeks pregnant. By the time you're giving birth, you already have milk. You have milk for the first 2 to 3 days. Yes.
Okay.
But because we don't know, a lot of people say, oh, they pressed, nothing came out. They used the pump, nothing came out. And because baby was going to breast frequently. So it means that baby is hungry. But your baby's stomach at birth is 5 to 7 meals. I don't know if you've ever seen a syringe. Exactly. That's incredibly tiny.
Yes.
And your baby is not going to fill that stomach capacity every time they feed. So a newborn can take 0.5 to 1 meals every single time they feed. So they're going to go frequently, and that's normal because it's only that constant stimulation that will make your milk come in. So when you wait and delay the gap, what happens is that your body is also waiting because your body is waiting to be stimulated. But we've missed the window. And so your body thinks there's
something there.
So it reduces. And what will happen is eventually, because what happens is, oh, I waited till day 3 or 4, then I got a bit engorged, and then the milk now came down. You get engorged because physiologically, from the 3 to 7, every woman who has a baby, whether CS, vaginal, whatever, she's going to get engorged because that is physiological. But then it will go back to what normal. Exactly. But if you didn't properly stimulate in the early days, when it drops, it really drops. And then it's a struggle to pick it back up. It's possible, we do it all the time, but it's a struggle. So it's not that, oh, they don't have milk at birth. But if they go into the hospitals, they don't know. And even the people caring for them don't know. So they think they're helping when they say, give your baby formula. But really, we're missing out on precious stimulation that we're not going to be able to get back. So I think it's more of a ignorance, lack of awareness thing than an actual problem with our mothers. Most women can produce milk.
No. So it's not the mothers. Mothers, do not be afraid. You're not the one who's the system somehow is against you, so that could be why. And when it comes to suckling, is there a particular way, or could that be a reason why mothers do not, maybe they don't understand how it's supposed to go through or what they're supposed to do? Could that be a problem? Because certain people will say, oh, during my mother's time, they say you need to drink a certain amount of
palm wine, coconut water, metal. I mean, I've heard it all.
Produce. So is that a thing? Was that just a myth?
So every culture has their own, but in my experience, and I've helped, Nigerian mothers from Ghana, from India, from, Ethiopia. So I know many, at least, cultural things, but they don't seem to work. What I've found is that for this particular mother, she might take avocado, and for some reason, that increases her oxytocin levels. So she has a greater letdown. A letdown is like in the course of expression, whether baby's feeding or there's a pump, the milk gushes out. So she thinks, oh my God, my supply is up. But if I give another mother avocado, it might not have the same effect on her. So you can find your own thing, but it doesn't cut across the board, one. And I think it's a very frustrating journey to be looking for the particular food that will be just, magic for you. Also, it's not sustained. It is, oh, I eat it and then maybe I have
for that.
But then you have to keep, eating it every time. So
that can be boring.
It can be frustrating. It's like a prison. It can be very frustrating. So, and also research, because we've done some science and we've done some research into this, and there's no backing into any of the foods, which I think is obvious because there are so many. I mean, people say fenugreek, people say fennel seeds, people say moringa, we have pap, we have coconut. There are too many things that someone said worked for her, you know. So I don't recommend that. I do recommend working with a lactation consultant because I think approaching it from a medical or like a science point of view will help. Is to remove the guessing game. The I'm just trying this because my friend said this is what works for her. Yes, and also just again breastfeeding early. The only advice, if I can just spend 5 minutes with the mother, I say immediately you have a baby, breastfeed. No matter what happens, just keep
keep the
breastfeeding,
baby
and honestly,
there.
most of the time you'll be fine.
Okay, so now talking about that, I want us to also touch a bit on. So there's some mothers that have excess milk.
Yes.
And then you see storage. How safe is that? Because I'm looking at the fact.
Freezer full, right? Seems like a lot of work just in.
So work.
So a few mothers will have something called hyperlactation.
Right.
So naturally, for some reason, maybe to just have extreme levels of prolactin or just the way their breasts mature during pregnancy.
Right.
But they might have a lot of milk, way more than their baby needs. But they are very rare. What usually happens is that women induce this hyperlactation because they think, oh, I have to, like, we call it feeding the freezer. So you are pumping not because your baby must eat, but because you need to see the milk in the freezer. Maybe you're afraid of something, but you just need to see all these bags and bags and bags. And social media is not helping. You know, everybody says, come and pour with me, man. Then you just see, and like, your baby's not going to finish this in a year, but you know, I mean, donate it, please. There are many babies that need it. But apart from the fact that they are inducing it, it can also cause lots of mastitis. So mastitis is like inflammation of the breast, where you could get a boil on your like you can get that on your breast and up to yes. And it's very bad, it's very painful, emotionally and physically, because you have to incise and drain the pus. And imagine you're breastfeeding, so your breast already a little bit tender, and then you now have like a giant boil there. So you can have it causes lots of mastitis and abscesses and a lot of clogged ducts. So that's like when the milk is so much, it's just not flowing. So there's like a traffic jam in your breast. So there's a lump and it's painful and red. It's really nothing that I would want any mother to experience. So you just want enough. You want, I can feed my baby in a day is always enough. But to store so much, I wouldn't advise that. But on the other hand, because we don't have a lot of, or we don't have a long enough maternity leave situation. So I meet mothers who are thinking, yes, so when I go back to work, I can't pump because there's no pumping room, there's no place to keep my milk. So I must start pumping from now. So they induce the oversupply and you know they keep getting the clogged ducts or the mastitis or the abscesses. So it's really traumatic. So I think again, breastfeeding is everybody's business. I don't think of it as a baby or mother business. I think of it as a human business because we want women in the workforce. We're going to think of these things. You know, do you have a room for pumping? Do you have a room for a fridge specifically for storing milk? Because that's the only way that she's going to resume work and not be thinking, but I want my baby to still be on exclusive. And her mind is at home, and you know, because she knows that, oh, I'll just pump and I'll take it home and they can use this for tomorrow. And then the day after, I'll do that for the other day and like that. So, but women don't have this. And, you know, they start thinking, oh, I must start pumping months and months before just so that when I go back to work, there's enough. Exactly. But then they use the oversupply and they have these issues.
Oh my word. There's so much there's so much to get to, you know, to get into this conversation. But because you know, time is never our friend when we're having conversations like this. But before I let you go, what are the dangers of formula feeding, especially for premies?
Okay, so I don't know if we've heard about the recalls, Nestle, all like
I've seen all the
brands.
Yes, they've been recalling
batches exactly.
I'm so great. I remember when I know of a baby that was on a particular one and within the first few weeks of him taking that milk, the way he expanded, he blew up like a balloon. His mom had to stop.
What's going on, right?
Stop that milk and find something else that she could
keep giving.
And so you know, situations like that make you open your eyes.
That was in this, right? Yeah, I can completely understand. So apart from even the cerealite contamination, you know, these batches that they are recalling, Formula predisposes your baby to childhood and adulthood obesity, diabetes, hypertension. It also causes like a predisposition to things like asthma. So anything like that's an atopy or allergy. So allergic rhinitis, allergic conjunctivitis, asthma, irritable bowel syndrome, all of those things have been linked back to formula. But for preterms in particular, like Dr. John said, it causes something called necrotizing enterocolitis. Basically, your stomach, your esophagus, your guts are just breaking down. It is literally like they're degrading. It is awful. It is very fatal.
And that is in babies.
Yeah, in preterm babies, nonetheless. So it's very, and also it's not because we know that, I mentioned that breast milk is dynamic.
Yeah.
So the breast milk that a mother who is preterm produces is higher in calories, higher in protein, and higher in antibodies. Because again, it's adapting to the stage of our postpartum. As per our body knows the baby has come out at, for example, 27 weeks. So the milk at 27 weeks is different from milk at 37 weeks, different from the milk when your baby's a month, when your baby's 6 months, when your baby's 2 years old. So breast milk is constantly changing for the states. Exactly. So formula doesn't have that. So we're not going to get all those benefits. The immunity that Dr. John mentioned, the increased caloric needs, because we need our preterms to gain weight faster than like a term baby. And also just prevents like the neck. Neck is devastating. I don't know if you know anybody that's had it, but it's deadly and like it's honestly fatal. It's devastating. It's the worst thing. It's the worst thing.
All right. Lagos, as much as I'd like us to keep going on and on this conversation, time sadly is not our friend at the moment. But we will revisit this conversation, possibly from another angle. But it's been a great conversation.
Yes.
Eye-opening conversation. You always hear breast milk, but you never understand the essence as to why it's always preached. Oh, give your baby breast milk. Give your baby breast milk. Now you understand. It's not just for the mothers and babies. Everyone should be a part of it. Teaching this and helping them achieve that satisfaction, or make sure that the babies have access to it. Well, this is how we do our cutting today on Smooth Health. It's been a great conversation. Okay, so Dr. Lope, how can we get across to you? I'm sure certain mothers would want to ask questions. Social media handle that they can reach out to you and take up the questions from there and what have you.
Okay, they can find me at Reddington Hospital, and my handle on Instagram is just Lope Adejuyigbe, or the Best Feeling Club.
Awesome stuff.
And also Reddington Hospital Group on Instagram. Yes.
Okay. Thank you so much for all that. Lagos, there's still so much to unpack. If I were you, I would remove a muscle. After the break, there's more music lined up for you. And you know what? Talking about women, how about talking about our love and why it is unique to show love to every woman out there? I'll leave you in the hands of Brandy. Don't move a muscle. Stay glued to your radio. Smooth 98.1.
Thank you for having us.